start over again. So we've got a webinar on lead generation in biotech, and I've got all the different platforms where we can go and find scientists that are interested in our products and services. So they're here on the screen. Let me show them. Okay, yep, I've got screen sharing. That's my LinkedIn. That's a quick presentation. And these are the platforms that I want to show you. So first, a quick note, why do we want to be specific about who we contact? Why don't we just pull out all the list, like a list of random scientists from Pfizer or EMD Serono or Novartis, and contact random people? So here is how I thought what sales was about. When I was a life scientist, I heard this saying that selling like a good, okay, we've got Daniel's coming in. Hey, Daniel, thanks for joining. So I thought that a good salesperson could sell a water to a drowning man. I've heard this phrase, and I thought selling was about like being a good talker, being persuasive, and so on. But once I stopped being a scientist and went into sales, I realized that, look, I really don't want to be a salesperson selling water to a drowning man. This doesn't work. I'd rather be a person who's solving real problems for people. They're grateful for me solving them those problems. I'd rather go find people who really need my products and services, and then everything downstream is super easy. So it's like selling water in a desert, but since I found this really picture of this awesome meerkats, I decided to say selling lemonade in the desert. And if we wanna be serious and just thought about all lead sources and all platforms, all kind of channels where we can sell our products and services. So these are main channels that we use. We start with a network. We can go use referrals when we have first customers, and if they refer us, that's fantastic. We can go to conferences. We can build our web presence using webinars like this, having SEO optimized website, doing LinkedIn posts like many of you guys are doing, and we can do Google Ads. Look, this is working. LinkedIn ads are working as well. But we also have outbound prospecting as a channel, as a tool for generating leads and for creating discovery calls and communicating with our target audience. So outbound prospecting has its pros and cons. And by the way, outbound prospecting starts with a targeted contact list, and then we go and we use communication channels like cold emails, LinkedIn messaging, and cold calling and site visits to reach out to that contact list. So outbound prospecting has its pros and cons. And Tessa is coming in. Hey, Tessa's in. So outbound prospecting has its pros and cons. The pros of outbound prospecting is that we can reach to our total addressable market. With ads and web presence, we only have people who are knocking at our door, but for each person that's knocking for our door, there is probably 10 other people that have that problem that we solve, but they're not actively looking, or maybe they haven't found us. With outbound prospecting, we can reach out to them. We've got Pratika coming in. Thanks, Pratika, for joining. And second advantage of outbound prospecting is that we can go after high-value customers. Like in life science and biotech, we all have academics that don't like to. Another person joining in. Wow, so many people. Thanks, guys. Thanks, you guys, for joining. So with outbound prospecting, when we can go after high-value customers instead of selling to academics that oftentimes tend to be time wasters. They don't have big projects. They like doing things themselves. We can reach out to biotech companies. We can reach out to research groups in pharma and have high-value customers by doing outbound prospecting. And third advantage of outbound prospecting that really stands out is that it's fast. If you guys get start cold calling right now, if you have a bit of skills of cold calling and a bit of drive to do cold calling, by the end of this hour, you would have spoken to 2 or 3 people who are in your target audiences and got your feedback and maybe generated yourself a lead. So cold calling is immediate, but even cold emails and LinkedIn messages, we get replies within a day or 2, maximum a week. And comparing to other sources of leads, this way outbound prospecting is way more efficient. By the way, guys, we are on Zoom, so questions and comments. I would love to see your questions and comments. Just drop them in the chat here. If everything is clear, fantastic. But look, you also guys doing all this lead generation and prospecting yourself a lot, so you have a lot of expertise here. So I would love to hear your comments, but also questions would be awesome. Let me go. So that was the introduction. I was trying to make it not long, but I think I dragged it a bit longer than I wanted to. But this is the first platform. This is the most efficient platform, the best platform that I'm using to find scientists that are interested in certain products. I'm here on LinkedIn, Sales Navigator. I'll show you in a minute how this same search looks on LinkedIn free version. I want to illustrate a specific point here. So I set up two filters. One is I'm looking just at Pfizer right now, and I'm looking at research as a function. So I want to show you the position titles that people have at Pfizer. And if we look, we have some position titles that are non-descriptive, like principal scientist. When someone has a position title of principal scientist, we have no clue what they do. We also have a position of senior scientist. Again, we have no clue what they do. So there are people like that. When they create LinkedIn profiles, they just say, I'm a scientist. And for us sellers and business developers, that's a big problem. But at the same time, we have people who do have descriptive position descriptions. So for example, target science, emerging science and innovation. That's a little bit difficult, but let's say director of data analytics, right? So if you providing sort of data analytics services, they could be a person. What else? Here is director of medicinal chemistry, right? So that could be a person depending on what you're selling. And here I pulled up a slide of some of the descriptive position titles that I used in the past and that resonated with some of my clients. So cell line development scientist, for example, process scientist, upstream process scientist, microbiologists, bioinformaticians, LCMS scientists doing clinical development, and so on. And here I've done a search for a process scientist. So we have head of formulation and process scientists at Roche, downstream process development, upstream process, analytical process development, and so on. And by using this description, if we can connect our product or service with this descriptive position title, then we can actually create a targeted list based on this descriptive position titles. A couple of other filters I have here, like I always set up industry to biotechnology research and pharmaceutical manufacturing. And I'm looking for specific geographic locations. Sometimes I'll be looking specifically at San Francisco or Bay Area, or I'll be looking at Massachusetts or United Kingdom or Germany. And in this case, I wanted to demonstrate for big pharma, so I put company size 10,000 people and up. This is the same search done on just LinkedIn without Sales Navigator. So I wanted to show you that when we're looking for leads, when we're looking for specific people, we're not severely handicapped. We are not severely handicapped if we don't have Sales Navigator. LinkedIn still have quite a few filters, very similar filters. They look differently, but we can select biotechnology and pharmaceutical manufacturing as an industry. We can filter by company size and by geographic location and so on. And that search, I clicked on something, but that search is very similar to what I found in Sales Navigator. Questions so far? I like talking fast. Let me see. So yeah, guys, we have a chat here. Don't want to be just talking. If you can drop questions, would be fantastic. But I assume that maybe most of you already use LinkedIn, so maybe you're bored. But I'll tick off LinkedIn and move on to another platforms in a second. So back to my screen sharing. Another search that I do on LinkedIn quite often is account search. So here I'm looking for companies. Here I wanted to focus on California only. And the interesting search here is therapeutics. So it's like small companies, small biotech companies that are doing preclinical and clinical research. And we can further filter them by size. We can look up, we can add additional keywords to go after small molecule therapeutics, about monoclonal antibody-based therapeutics, immuno-oncology, and so on. This company already have a bit of money, a bit of funding. They're doing preclinical and clinical research, and they're under time pressure to develop their drugs, to take them from preclinical to phase 1 to phase 2 and so on. And because they are under time pressure and they have money, they do outsource their services. So if you knock at their door with something that helps them to develop their drugs faster, they'll be happy to hear from you. So this is account search. Here, I wanted to illustrate the difference of what happens when you do account search on Sales Navigator versus what happens when you do account search on LinkedIn. And actually, in this case, you will be severely at disadvantage if you don't have Sales Navigator. So here I put RNAi as a search term. Again, the same industry. We have quite a few results here, 86 results. But what you see on LinkedIn, the same search, no filters set up, so I don't have any filters that would restrict it. I only have 2 results, and one is actually in real estate and only one in biotechnology. And what I think is happening here is that while LinkedIn Navigator is looking for company descriptions, so if we look at Alnylam Pharmaceuticals, we see that they have RNA therapeutics mentioned in their description, but LinkedIn proper, just basic LinkedIn, only looks at the title. So if you have LinkedIn and you're trying to search for accounts, you don't have Sales Navigator, you will be at a disadvantage. Next platform I'll bring up, and usually when I talk about finding people who are a good fit, finding good scientists that are good fit, the first question that comes up is, where do we get their email addresses? So let me address that. I'm here on a platform called Apollo. It's apollo.io. I put a name of a person that just popped up on LinkedIn, George or Jorge, at VP of Global Rare Disease at Alnylam Pharmaceuticals. And on Apollo, you just click this button, you grab their email and phone number. And Apollo is very precise when it comes to getting these emails, not phone numbers. I don't do phone numbers in this case, but with emails, they all get delivered, rarely bounce. And also about 80% of the people to 90% of the people would have their email address on Apollo. So Apollo is very complete as a database. So here I found Jorge's or George's name here by doing a search button here, but you can also use a data enrichment function where you upload an entire list and Apollo will give you the list. So this is a data enrichment kind of view of Apollo. You can select a CSV file, a list, upload the list, and download the list. Okay, we've got something in the chat. Yeah, so Marius is asking, is it possible to get the email address from LinkedIn without Sales Navigator? Great question. Marius, we're not getting email addresses from LinkedIn, and Sales Navigator doesn't have email addresses. So we're getting email addresses from a tool like Apollo. Cool. Got Marius' question answered. So another awesome thing about Apollo, it's free. It's not like free, but you can get up to 50 email opens, 50 email credits per month with a free account. So you can try it for free. Every month it gets renewed. If you want to be sneaky, someone's messaging on LinkedIn me. I have too many things open. So if you want to be sneaky and open 2 different accounts or have 2 people in your company open accounts on Apollo, you get 100 email checks per month. That's more than enough to do basic outreach to grab those email addresses. But even if you want to go a little bit further, their basic plan starts at $50 per month. And look, guys, I'm pitching Apollo. I'm not associated with Apollo, but they're so awesome that they're worth getting this free account. Another thing in the chat. Cool. Tessa is asking, is that the way to get phone numbers from the company website? You get phone numbers from company website. With smaller companies, it's obviously easy. They list it. But I do have a case of calling AMD Serrano. I knew the name of the person I wanted to talk to and their position, and the operator transferred me to that person. So you can call massive pharma and you'll be transferred, and smaller companies, they list it, but you just have to actually go through that phone number on the that listed on the company website. I think Apollo gives you their mobile number. I wouldn't call mobile numbers because I feel it's too personal. I want to call people about business on their business numbers. Now, so mentioned that Apollo is free. You guys absolutely have to get trial just register, just so you can get those free email addresses played. But another thing that's awesome about Apollo is that you can use Apollo to search for people as well. So here I'm actually using platform for what it was meant for. I'm looking for scientists doing cell line development and cell line engineering. I'm looking again, biotech and pharma. I have 221 results. They're really specific: cell line engineer, biotech companies. Even by looking at this list, you can see that this is a good list. This guy already checked his email previously. We can click on it and we can see that we have his email address here on Apollo. But the funny thing that if you start from here, Apollo is also an outreach platform. So you can just click on these names and you can start an email campaign straight from here. So you don't have to go through the process with Apollo. If you start from Apollo, if you start from LinkedIn, you have to get people's names, create a list, then get their email addresses, then transfer it into HubSpot or your just mail client and send emails from there. With Apollo, you just click it and you send your emails. So you can save yourself a lot of time if you just do that process. By the way, I'm not doing it. I'm doing it the old school way, just looking at everyone's email addresses and creating lists. So I'm just not there yet. Next up is SciLeads. SciLeads give you a free trial for a week, and I'll show you what's inside in a second. Can you make a list to export from Apollo? Yes. So SciLeads, this is what is inside of SciLeads, and on your screen it's probably really small. But 7 days free trial. But why do you want to do free trial? What's really awesome about this platform? So here I put a search. I forgot what it was, what I was looking, probably target discovery scientists. These letters actually blurred people's names, not to reveal too much. But what's really like, how to go about explaining. So we are looking at people from biotech and pharma companies that published papers and presented on trade shows, on conferences. And these publications and trade show presentations are related to our keyword. So if we look at this first person, they published 52 papers. They are from Halia Therapeutics, and they published 52 papers on this subject. We have someone else who published 33 papers and so on. And the beauty about this is that when we look into those papers, we can know what these people are really working on, what they really care about. That's one angle. But another angle is that when we are designing our outreach, when we are writing our cold email copy, we can say, hey, I saw your paper on this. I have something awesome to offer for you that makes your life easier. So that outreach is very targeted, very specific, very personal when we're referring to a paper or when we're referring to a trade show publication. So that's why I loved SciLeads. When I was trying it, I was like, seriously awesome. The kind of disadvantage that I found at the time when I was doing the trial, I was working with 4 clients and I did searches for all of their keywords. And in each case, I found golden nuggets, but I didn't find like a trail of gold. So it was worth to check to find something cool, but I didn't see how that particular client or that particular situation would benefit from 1-year subscription. We've got Megan's coming in, got one more person on the call, which is awesome. So that's SciLeads. Definitely try it, just a free trial. And if maybe you're going to find that golden trail that you can keep mining, and maybe it's going to be worth for you to do that 1-year subscription. Now, how do I return to my Chrome? So that was SciLeads. Next up, I have SBIR. So it's called America's Seed Fund. So that's another very interesting platform. So it's US government giving grants to academics and small companies to do biotechnology research. here I put the keyword gene therapy. Let's see what came up on the first search. So this is the first entry here. We can read about the project, see if it's a good fit for what we have to offer. We have person's name, phone number, email address, which is like, holy cow, straight away. The amount of funding is really small, but at the same time, realize that these companies also want to develop something and they can't do everything in-house. They don't have all capabilities in-house. So if you can offer something that complements and makes their life easier, they have some money to pay for it. A little caveat about SBIR, companies actually go out of business pretty quickly. So if you have a company that got SBIR grant like 5 years ago, there is a chance it could be not there anymore. So right now, when I'm creating lists from SBIR, I actually go back to LinkedIn and make sure that company is still in place. Also, it's possible that this person that's listed here and this email address that's listed here is not the best contact. So I still go back to LinkedIn, check who is there on the staff, and decide who I want to contact at SBIR. 2 more platforms like SBIR. So that one was for US. Now I have one more question. Zapirus. Oh, cool. Yes. So now, guys, Paul is saying that there is another platform called Zapirus that I haven't heard of. So, so this is where I'm learning from you guys, and we are making this call so much better by working on this together. So let's just see what Zapirus is about so we can have it for a record. Zapirus. There you go. So yeah, guys, look, I will look into this in the future. You guys, this recording will go on YouTube, so you can watch it there, and I'll drop a recording on LinkedIn in the chat. So, but I haven't seen this in the past. I'll explore it, and you can also look into it. Thanks for the comment. So another platform similar to SBIR, it's called UKRI. So it's the same thing, but in the UK. I'm looking for active projects, collaborative R&D, so company and academics, and R&D grants, and small business research initiatives. So it's combined like academics and biotech companies. So here, again, the search was for gene therapy. Here I am on another platform for Europeans, so it's called CORDIS. I only discovered it literally yesterday because I thought there should be one in Europe. And I jumped on it and it's there, so I haven't explored this. But judging even by the first entry, it looks like a good fit. Next up, this is a conference on enzyme engineering. And I wanted to bring this up because you all guys are familiar with conferences that happen in your niche, in your kind of corner of biotech industry, but you don't always have a chance to go. This one was in Singapore, and not everyone is fortunate enough to jump on a plane and fly to Singapore. But interesting thing, you don't need to go there. There is this thing called Final Program with the poster list. I have here in a separate tab. So this is Enzyme Engineering Conference. And if I scroll down here, I can see attendees. I see the talk titles. So again, I can just find this person, Marina from Zamwell Biomodeling in Spain. I can find her on LinkedIn. I can grab her email from a poll and I say, hey, I saw you had a talk at the conference. I have something interesting for you to offer. Would you be interested in a conversation? So this way, whatever conferences you're not going to, you can actually go through the list of people and reach out to them. And they're still going to be a good fit for what you're doing if you put a thought in who you're contacting. Completely jumping the topic, this is Biocompare. You would be asking yourself why Biocompare is here in this presentation. Normally, if you work in the lab, Biocompare is where you go to buy stuff, to look for products. And by the way, you guys probably can list many of your products and services here. But the interesting thing that all of these suppliers of products and services They can be your partners. You can be a white label manufacturer for them. You can produce antibodies for them. You can develop enzymes for them. You can develop custom plates for them. You can do a lot of custom work and partnering with all of these companies. So I noticed that some people who registered for this webinar were in microfluidics business. So I put lateral flow kits that use microfluidics, and we have 12 suppliers, which is not that many. But we have all these companies that develop lateral flow assays, and they could use microfluidics devices. So this is just one of the many examples where you can use Biocompare to find partners, to find people you can sell to. So Biocompare. I think there is a similar platform here as SciSelect. So SciSelect is pretty much Biocompare, just a different one. Maybe here you can find slightly different companies. Jumping to academics. So everyone's been on PubMed. It's nothing new here, but I want to show you a really cool filter that I found on PubMed that allows you to find some really interesting stuff. So this is a search term. There is a company in Maryland that develops glass slides with custom coding that allow you to study this EMT process, epithelial to mesenchymal transition. This is basically when epithelial cells become cancer cells and can start moving. So with those glass slides, researchers can do better research. So this is basic search on LinkedIn, but then we can do advanced search. And my favorite advanced search is looking for affiliation. Here you can see there is a lot of entries, 12,000 results. We can obviously set up a filter for the last year. But with this filter, if we say USA affiliation, we cut out all the papers from China and India and all other countries, and we can sell to someone who is in the US, who is much easier to sell to, and have nothing to do against scientists in other countries, but we already tried selling to reaching out, doing cold outreach with scientists in China, and they just don't reply for some reason. So there's obviously something very different happening there. So I want to filter to the geographic locations that I know. Now, because that company I mentioned that makes those glass slides, they're located in Maryland, and I put actually MD for affiliation. So this is what I find really cool, that you can look for people at research institutions literally next door to you. So, and this is the first search here. And this research group is from Johns Hopkins University in Baltimore in Maryland. So imagine if you have an academic institution that next door to you, or maybe you're located on a campus, you can do this PubMed search for that research institution, and you can play a local card where you can say, hey, we're a local startup on your university campus next door, 5 minutes down the road, half an hour down the road. We have this great technology, let's meet. We've done that with someone, it works. And also, using this, when you have someone next to you and you can go and visit them, it's quite much easier to do a demo, go and meet in person in this digital world. That's a massive asset. So that was PubMed and my little twist on PubMed. And another little twist on this I've done before I've heard about these guys, before I heard about SciLeads. Another little twist I've done, I've searched for affiliation with Pfizer and Novartis and AMD Serono, and I found research groups that working on a specific subject, but coming from a pharma company. Next platform is Google Scholar. Google Scholar sucks because we only have one filter. We can just sort by select papers that came in the last year or 2 years or whatever, custom range, and you don't even can select by months or a year. But what's really awesome about Google Scholar, what PubMed doesn't offer you, is that Google Scholar searches entire paper. If the paper is in the public domain, Google Scholar will go and search materials and methods, will search another paper. So one of the clients I'm working with, they have a technology that's complementary to Hugh protein arrays. And usually the paper mentions the kind of protein array they're using. They mention it somewhere deep in materials and methods. But if you put it in Google Scholar, it will pull out all the papers that mention Q-prot protein arrays in their materials and methods. And we contacted them and we got a good reply rate. Here is a different search term to demonstrate that. So last week, I saw a website of an interesting biotech startup in Germany, and they're piggybacking on digital PCR machine from QIAGEN called QAcuity. I hope I'm pronouncing that right. And what they're doing, they're allowing to scientists that have that machine already in their lab to do interesting protein-protein interaction experiments. So QAcuity digital PCR is from like nucleic acid, DNA, RNA. Don't even know if they do in DNA. But if they have it in-house in the lab, they can actually do protein-protein interactions. And if you are a research group and you're trying to get another awesome figure for your paper, doing an interesting experiment with a technology you already have in-house, that's a massive win for you. And here, a Google Scholar searched all the papers that mentioned QAcuity in materials and methods and pulled them up. So that's why I love Google Scholar. And just for a comparison, if we do the same search on PubMed, we only get 9 results. So these are results which mention QAcuity in the abstract. Next up, we have just few more guys. We have 40 minutes, probably 35 minutes since we started. This is NIH Reporter. So the same search, epithelial to mesenchymal transition, but the difference here is that we're looking for the grants that are funded right now. So we have 276 projects that are already funded. The great thing about PubMed is when people publish the paper, we know that that group is interested in the subject in general, but on the Reporter, we know that people just got funding recently to do that kind of research. So that's the advantage of Reporter. But why I love Reporter is that you can look for core facilities. So here I put core, and it's bringing up microscopy core, bioinformatics core, and all kinds of core facilities that can be our customers. When I was a sales rep at Leica Microsystems selling microscopes and sample prep equipment for electron microscopy, core facilities are like a third of the business. Core facilities, they get funding from places like NIH, they get funding from academics in their research institution. They pull all those resources and they want to buy the latest and the best instrumentation and technology to keep their institution at the top of their research. So facility managers, they're accustomed of dealing with sales reps or at evaluating new technology, and they have a lot of money and they want to spend it by the end of the year every year. So core facilities, whatever you're working on, protein crystallography core facilities, histology core facilities, all kinds of core facilities. If you can find a core facility, that could be a good customer for you. The only caveat about this search is that people who apply for these grants usually do not manage cores. So it's usually high-end academic who's applying for grants. So this is an example of such a facility, high-resolution microscopy facility at Iowa State. So instead of contacting the person listed on that grant, I would go to the facility website and find the name of facility manager. And luckily enough, they actually list the name, email address, and phone number right on the website. So if you want to sell to facilities, you can start your search here and then move on to the specific website. We got a question coming up. Okay, Megan says that it's still worth to check NIH Reporter because key personnel from the facility is listed on the NIH grant. Yeah, cool. Yeah, absolutely. So, so in this microscopy core, we've got project leader and yeah, definitely grab whatever information you can. Grab it from here. So here we have Jackson William professor and program official. Yeah, program official is from NIH. So I probably wouldn't want to contact a professor who got this grant. That was what I was referring for. But if I have a facility manager listed here, I'll definitely contact them. Just two more for you guys. Just stay with me. So this is a next platform. Successful partnerships between cores and your clients. Okay, Tessa's asking about successful partnerships between cores and clients. Actually, my main core facility experience comes from Leica. And look, we had relationship with core facility managers. We're there all the time because they buy our instruments on a daily basis. But with startups and service providers, haven't done selling to core facilities yet. So maybe you guys will be the first one who will let me know. And finally, so this is so there's 2 points I want to illustrate here. So this is National Society for Histotechnology, and it has a list of histology schools and programs. And one point I want to one thing I want to point out is just going to industry associations website. So this is Association of Histotechnology Schools. And the beauty of this, we have all the histology schools, histotechnology schools listed. We don't have to go to LinkedIn or anywhere else. They're all listed here, ready for the picking for us. And if we go to individual school here, Mount San Antonio Histotechnician Program, scroll down, the name of the person, Jennifer McDonald, email, phone number, like just as easy as that. That's one point I want to show here. But another point from this National Society of Histotechnology is that universities spend a lot of money at equipping their educational labs. So in this case, histology labs, right? When they're teaching students histology techniques, they need microscopes, microtomes, slide staining instruments, some dyes for staining those slides. And they need something low end and rugged that students can break. They need something a little bit on the cheaper end, but at the same time, they buy a lot of it. And again, back to my experience at Leica, while I was a territory manager in Melbourne, University of Melbourne built a facility, like a big new building for veterinary sciences, and they equipped it. They spent $700,000 on microscopes, and God knows what else they put in that building. So, and quite interesting that most of biotech startups, when I look at them, they don't serve this niche. Maybe because it's not as posh, but look, this is a really interesting niche, like educational biotechnology, life science products. Finally, I'm here on Google because when I was doing this search, I couldn't find this facility anywhere else. So it's anatomic pathology facilities in different states in the US. There is no industry association. They don't seem to be getting funding from NIH. Maybe they do, but they didn't show up in my searches. So what I've done, I just went state by state, look at anatomic pathology facilities in different states. When you go to an anatomic pathology facility state, you get email, phone number, person to contact. So that's all I've had for you, and I'm running out of time. Any more questions or thoughts that you guys have about everything that I've been talking about? And while you're thinking about that, I'll just show you the next webinar that I have planned for you. So next webinar is how to write a cold email copy and turn it into a LinkedIn messaging script. Most likely it's going to be middle of January. I put a tentative date. So if you've been on this call or registered on LinkedIn, I'll send you an invite, and hopefully streaming will work better next time around. Any final questions before I close the call and let everyone go? Okay, Megan says this was lovely. Thank you so much. Thanks, Megan. Paul says thanks, really interesting. Thanks, Paul. Tessa says thank you. Thanks, Tessa. Thanks for the questions. Sorry if one of them seemed like a brushed off. Apologize for that. But yeah. Kaspar says thanks a lot. Very interesting. Thanks, Kaspar. Okay, I see people exiting, moving on to their things. Waiting in case someone who is still here want to add a one more question or a comment. Right, everyone's gone. Let's close this off, put it on YouTube, put it on LinkedIn.